Road Surgery, Sim speaking. How can I help?
How's your anxiety?
Doctor, you know I haven't been in a good place. I'm trying to get better and it's just hard.
I think it's worth referring you to get this all checked.
Yeah.
And I think we need to do it urgently on what's called a cancer 2-week wait referral.
Ignore the behaviour you don't want to see again and reward the behaviour that you wish to encourage.
He tickles.
Yeah, sorry. It's always tender.
I had that breakdown.
Yeah.
Then I was made redundant.
Yeah.
And I found out this is happened ever since. It's all going downhill.
It never comes in once.
No.
Your appointment was at 10:10.
10 past?
Yep.
We're gonna have to wait a long time to be seen. It is manic.
With a bit of luck, I'll be running to time, but I won't guarantee it. Evelyn will see how we go.
That's why my blood pressure goes.
Yeah, I'm not surprised.
Sandra, take a seat, darling. I'm just going to speak to the doctor.
Yeah, because I'm already...
Yeah, that's fine, my darling. We didn't arrive you. So it's our fault, but I will just speak to the doctor.
Hello?
Hi, is that Serena?
Yes, hello.
Hello, darling. Did you get my screen message?
Yeah, I've just replied because I was with a patient.
OK, she's been sat here 2 hours.
2 hours?
Well, she came to book at 8 o'clock and then they forgot to put her in. Forgot to arrive her.
So she'd been in the waiting room since 8 o'clock?
Yes.
So whose fault is it?
Hours.
OK, I'll see her then. OK.
OK, thanks, bye. She's going to see you. She's going to call you now, darling. OK.
I've had a horrible morning.
We're fine.
I made a mistake this morning.
This morning I made a mistake because obviously when it's so busy and we're booking in patients.
Sandra Tamraska? Hello. It's Dr. Hyder. Come and have a seat. I'm sorry you had to wait so long. And how can I help you today?
I just have some infection in my nose.
Okay.
And I have some in my face as well.
So how many weeks pregnant are you?
7 or 8.
Okay. So any fever at all?
No.
Okay. Cough?
No.
No? Okay, that's all right. So let's just look at the back of your throat to start with. Let's just do a big ah. Yeah, okay, so it's quite red.
Yeah, because I'm vomiting.
Oh, you're vomiting because of the
Yes.
pregnancy as well. Yeah. Let's have a look in your ear. Okay. A little bit red, actually. Yeah. So both of the eardrums look like there's some pressure behind them as well.
Oh.
Now, that can sometimes be if there's an infection going on here. Can I listen to your heart and breathing?
Yes.
Okay, you're okay. No, it's fine. I just want to feel your face. Is pain across here at all when I'm pressing? No. What about across the front of the head?
No.
But you're feeling congested up here?
Yeah, I just feel like here.
Right, OK. When you blow your nose, what colour is it? Green, white?
Green.
Green, oh, it is green. OK, your chest is all clear.
Okay.
All right, so I think it is coming from the sinuses, the infection. Come and have a seat. Are you allergic to any antibiotics? No. So we could give you some amoxicillin, which is OK in pregnancy.
Okay. But can you give me any cream for that or something?
Let's have a look inside. So it's feeling very sore, is it?
And it's really...
Yes, yeah. Yeah, I can give you some cream for that as well.
Yeah.
So that's your antibiotics and that's the cream.
Okay.
OK? And then come back and see us if you're not feeling better.
Okay, thank you.
All right, I'm sorry you had to wait so long.
That's the light.
Take care then.
Thank you.
Bye-bye.
Bye-bye.
Hello. In we come. come in, take a seat.
Thank you.
How are we doing?
Yeah, actually, he's coughing.
Right.
All night.
Yep.
All night he was crying with the runny nose and coughing very badly. And he vomiting as well. He bring all milk out. So that's why we're worried about it.
Okay, we'll have a listen to his chest, shall we?
Yeah, that's fine.
And see what it's like. Let's have a quick take of his temperature. Oh, that's a smile, isn't it?
Yeah.
Thank you.
All night he was crying and now he's smiling.
Absolutely. Well, there we go. There's a cough as well. So we're going to have a listen to that. Okay, if you just pop his head to the side slightly, and we'll just try this temperature first. Okay, so no temperature, which is good news. We'll have a listen to that chest before he starts crying. Oh, you're not going to cry here, not when you look so happy.
All right, or shall I remove the...
That's fine.
Is that right?
Okay, so his chest is nice and clear. He does have a little wheeze to it, okay?
Yeah, sometimes I feel like
yeah.
when he breathes,
You can hear a
uncomfortable.
slight
Yeah.
wheeze at the moment. Now, okay, so let's talk about the good signs. Okay, the good signs are that his breathing is nice and slow. He's not panting. He's not panting away very fast and rapidly, which would be a bad sign. He's not grunting when he breathes. Like that. That wouldn't be good. He does have a little wheeze, so there must be a little bit of narrowing of his airways to some degree. All he's got at the moment is probably a little viral infection that's given him a slight wheeze, okay? So what we need to do is give him, he's only tiny, but that we can use an inhaler to try and help that. What I'm going to see if I can do is get one of the nurses just to show you how to use that.
All right.
Okay, 2 seconds. Let me see if I can convince one of my colleagues.
Yeah.
I've got to see a doctor. I'd like to see Dr. Morrison.
Right, well, actually, your doctor is Dr. Ward.
That's Dr. Ward, is it? Okay. It's a good name for a doctor, isn't it?
Yep, absolutely.
You haven't got a nurse surgery, have you?
I mean, don't worry if he gets a bit upset and, you know, if he's crying when you're trying to give him it, because sometimes that's better, because as they're crying, they're taking deeper breaths.
Deep breath,
so it's...
The medicine goes in.
Yes. Pop it in. Okay, right, so we'll just see how he takes it. What's that? Good boy. Oh. That's it, good boy. So this is just to help with the cough whilst he's coughing so much. All right,
Thank you
okay
very
then.
much.
All right then, take care, bye-bye.
Terence Edwards. I'm fine, how are you? Nice to see you.
Thank you.
That was a good result yesterday.
Yeah, brilliant result.
Wasn't it? Yeah. I didn't
My
see that
day.
coming. Made your day, good.
Made my day.
Good, good. How are you?
Not too good, because they've classed me with mild heart failure now, Chris.
Okay.
My feet are still swelling.
Uh-huh.
I'm still out of breath a lot, and I'm still coughing in the mornings.
Right, okay.
And I'm finding it very hard to walk long distances now.
Okay. So who's looking after you? Is it the hospital or...
Nobody.
Is it us? Nobody?
It is.
Okay. Who would you like to look after you?
You.
So what do you understand by the word heart failure?
I don't know. No one's explained nothing to
Okay.
me, Chris. Nothing's...
So we all get heart failure.
Yeah.
If even the fittest athlete runs down the road, eventually they will get out of breath, and that's because the heart can't pump the oxygen around the body enough. In your case, you're getting it short of breath at a very early stage of exercise, and this is because your heart is enlarged and it can't pump as efficiently, so it can't get the blood around the heart, around the body as well as it would like to.
Yeah.
When you go to bed at night, you lie down. All this water that's collected in your ankles drains back because your feet are up to the heart, and then there's too much fluid in the blood circulation and in the lungs, and so it tends to collect in the lungs and it makes you cough.
Yeah.
And it makes you feel short of breath at night.
Yeah.
So one of the things we need to do is to reduce the amount of fluid in your body. One of the ways we treat heart failure is giving patients diuretics or water tablets, which reduces the amount of fluid in the body by increasing the amount that we pass out in urine. This, therefore, gives less total fluid in the body, reducing the strain on the heart to get the blood pumped around the tissues and back to the heart. The other thing is to try and make your heart beat more efficiently.
Yeah.
Now, you're on some tablets for that, but there's another tablet we ought to give called a beta blocker, which we know helps your heart to beat more efficiently.
Okay.
Now, you have to be careful with these. If you give them a too high a dose, it makes the heart slow down so much it doesn't beat enough to get the blood around. And so it makes the heart failure worse.
Right.
So we start off at a very low dose and work our way up.
Okay, Chris, yeah.
Okay?
Yeah.
And increase the doses until we get you feeling better.
Okay, Chris, yeah.
Is that okay?
That's fine, yeah.
Right.
I had that breakdown.
Yeah.
So I was under the Dr. Sultan for that there still.
Yeah.
Then I was made redundant.
Yeah.
Then I find out this is aponeurysms. It's all going downhill.
It never comes in ones?
No.
Can I see you first thing next Monday morning?
Okay, Chris.
Could you also, please, for the end of this week, have a blood test done?
Yeah. Thank you, Chris.
Okay, take care.
Yeah,
all the best. See you next week.
Yeah, cheers.
Bye-bye.
Bye, Chris.
So something for his skin, is it?
Yes, please. That's the one.
So mometazone?
Yeah,
that's a really strong steroid cream.
Yes, sir.
This is not something that we would ever put on repeat for a child. Importantly, what we need to assess is how is his eczema?
His skin is fine. If you can have a look over here, everything is...
So you can see there's some redness just here, can't you? Kind of classical eczema, dry skin.
Yeah.
How about his arms?
Arms? It's here.
Oh, wow. OK. How about legs? I like your trainers. OK. So that looks quite sore, doesn't it? You can see he's been scratching at it. OK. What's his bath time routine like?
His bath time routine is like two or three times a day, a week.
OK, so not having bath every day. We know that things like soaps, shower gels, bubble baths, they all make the skin dry. He doesn't use any of those. That's perfect. What we could give you is a tub of cream, and when he is having a bath or a shower, you can rub that in all over the body and then just wash it off. Twice a day is good. It would be even better if it was 3 times or 4 times a day. Here's the crucial bit. Eczema is a dry skin condition. If you chuck moisture at dry skin, it's going to be perfect. It will work. That means then you don't need the steroids. Because we are really reluctant as doctors and clinicians to give steroids, especially in a child as young as Nirmit, who his skin is not going to be like your skin. Okay, it's going to be thinner. And steroid side effects are that they make the skin even thinner. So these should be reserved only to use when there are flare-ups of eczema. I'm really concerned about how strong that is.
No worries.
And at the moment, actually, his skin's not that bad. It doesn't need the really strong steroid. So I'm going to keep those 3 things on repeat. So Cetrabem will be on repeat, soap substitute tub on repeat, and an antihistamine to drink once a day. And that's his regular treatment. That's the time to come and see us, and we assess the need for steroids.
That's fine.
All right? And it looks like we can send this prescription electronically just to the pharmacy. I'll do that right away.
Thank you very much.
You're welcome. Nice to meet you too. Take care.
Say bye.
Bye-bye, young man.
Bye-bye. Have a nice evening.
Be good.
Enjoy.
Take care, you too.
Why do people have paracetamol on prescription?
Don't know, it's 16p in shops.
But it costs us like £10. Well, not us, but you know what I mean. Oh, my God.
I've had a bad morning. I can't breathe properly.
I was going to say, is it your chest or your stomach? I couldn't tell.
I couldn't tell. I don't know. What I've been having like in the night time, like food is stuck in my here.
Yeah.
But I've been coughing. I've been taking my inhaler.
Yeah.
And I know I'm really chesty at the moment.
Okay.
Yeah.
Anything coming up?
Yeah.
What colour?
Brown.
How's your anxiety?
Don't have my moments, but don't feel too bad at the moment. But I'm anxious about certain things. So I've got a lot of changes going.
Yeah.
I'm going to go back to work.
Okay.
Part time. I'm going to go back because my sick note finishes on the 15th, but I need to get back.
Do you think some of how you're feeling might be related to that this morning?
I don't know. I was trying to remember when I had these sort of feelings before, and I'm thinking when I used to have really bad asthma when I was little.
Okay, let's have a look.
It feels like it's my lungs, and I was thinking I've got lung cancer. I'm dying. Doctor, you know I haven't been in a good place. I'm trying to get better, and it's just hard. My daughter's at grammar school, and she's studying PE, and it tells you about health. It says that the definition of health is to be able to take normal stress in a normal way. Isn't
Okay.
it? And I don't, so I'm not healthy.
Can I get you to stand up for me?
I'm not healthy,
I want
doctor.
to have a listen at the back, okay?
Right, it was with Dr. O'Donnell. Your appointment was at 4 o'clock. You're late.
I did try to ring him, but...
Can I ask why you're late?
Well, I've had to walk all the way here and been in pain.
You're Katrina Lillywhite. She's about 10 minutes late, well, nearly 12. 12 late because she had to walk to the surgery. Are you still able to see her? Or? OK, no worries. Thank you. Right, he will be able to see you, but you will have to wait until the other people have been seen who have been on time.
How long's that going to be?
I don't know. And he will see you as and when, OK?
Yeah, that's fine.
Oh, what kind of a driver are you?
Oh,
Good.
This pushchair.
How are you?
I'm good, thank you.
Can you manage?
Yeah,
good.
that's it, we're in.
Okay, good. Hello, boys and girls. So, what can I do for you? Sorry for keeping you waiting.
No, that's fine. Basically, what it is, I suffer with abscesses and boils
Okay, and where do you get them?
under my belly and on my legs.
Okay. And how long has that been going on for?
Enough 2 years now.
Really? Okay.
They referred me to Plastic.
Yeah.
Had the hospital appointment yesterday,
Yeah.
but I'm in literally pain.
Yeah. And what did the plastics say?
They're referring me to a specialist that
Deals with this. Yeah. Okay. Okay. And right, just pop yourself over here. So just show me where this is travelling. I see. Yeah, indeed. Yeah. So these are predominantly associated with weight and with excess tissue rubbing on other tissue. So because this comes down and it rubs against your lower abdomen, your thighs, it causes friction. And the friction weakens the skin, and bugs that normally live on the skin but normally wouldn't cause a problem.
All down the bottom.
Oh, I can imagine. I can see that it is inflamed. Do you have any under your arms?
No.
No, it's all down here. Yeah,
It's all
yeah,
down here.
yeah. Right.
Stand up. Right, someone come down, please. Right, come and sit down here with Mummy. Good. Come on. Yeah, sit there then. Good girl.
Can I get you to come and lie down on there? Because you were talking about that food sticking, weren't you?
Yeah.
Is that okay? Yeah. How can you feel it?
It's a bit painful there.
Okay, that's fine. I'll get you to sit back up. You all right?
Yeah.
Let's just say Say again. Yeah, it's a bit on the red side. Do you know what?
What?
Your saturations are fine. Your chest is really nice and clear.
No, so what's happening?
So I think it's just a cold, really. But I wonder whether the stress is making everything worse as well, which is why you were getting some of that food sticking symptom as well.
Yeah.
But let me put it to you like this. I'm not worried that your chest is too bad at the moment. And of course, I want you to stop smoking.
I am.
Because that's going to make all of that stuff
Yeah.
worse, isn't it?
But if I had lung cancer,
Okay.
what would I be getting food trapped in it?
What's making you worry about cancer?
Because my dad smoked a lot. My dad was a heavy smoker.
Okay.
He had throat cancer.
Okay.
So I got scared last night.
At the moment, there's nothing in there that makes me worry about cancer right now.
Okay.
But of course, you're right. With the smoking, you've got
Yeah, I know,
the risk is
yeah.
higher, isn't it? Which is one of the reasons why I want you to stop.
Yeah.
I mean, I know you've done well, haven't you?
And I've given up the Red Bull.
Yeah,
And
good.
I'm working on trying to give up this. I haven't got my patch on today.
Do you come to the clinic here?
I started and I stopped because I had so much things going on. But I'm now going to be.
So you're going to restart
Yeah.
it? Okay, fine. So in a short time, it is literally just things like paracetamol and stuff, but I'm going to give you something for the stomach as well. Is that okay? If you think things get worse, then I want you to come back to us, okay?
Okay. Thank you.
No problem.
Take care.
Take care, all right?
I'll see you again.
You too, see ya.
See you. Bye.
I think you need a combination of antibiotics at this stage, really. It would be really good, from your skin point of view, if you were to avoid all forms of sugar. So no sugar into your coffee, no sweets, cakes, chocolate, paste. Just don't eat anything with sugar in. Yeah, good.
Chocolate.
Do you take any sugary drinks at all?
Oh, the only drink I do drink is Ribena.
Yeah, it has sugar. And,
So I can't drink plain water.
one thing that sugar does is it weakens the immune system, and your immune system isn't able to respond as well. Try and steer clear of sugar, because sugar and friction and genetics are what contribute to this kind of situation. Okay?
What? No. Enough now. Come and sit down. Pull your trousers up, please. I'm here, Albie, I'm here.
Yeah.
What are you doing? Stop. Leave him. Right, that is enough. Les.
No, it's just sometimes children are like that.
Whatever it is, because they want to run about and do things. That's what it is.
Yeah. The best thing to do with children, as you probably know, being a mum yourself, is ignore the behaviour you don't want to see again and reward the behaviour that you wish to encourage. So just ignore when they're doing things that you just continue to talk as if they weren't doing it. They'll eventually stop.
It is hard though.
I know it's hard, yeah, I know it's hard. And the thing is, any response from you is a reward. So even if you give out to them, it's a reward because they're getting your attention.
Right, come on, let's go. Let's go home.
Bye-bye. Yeah, time to go. Yeah, yeah. Actually, they do very well on ignoring them. Yeah.
Beautiful, thank you.
How can I help?
I came to see Dr. Moyes a week ago on Saturday. She sent me out to the hospital for some blood tests, X-ray to do because I have this disease. So I was 8.5 months off work last year.
Right.
8 weeks in hospital, 2 weeks in intensive care.
Gosh, okay.
Something's not right. I'm getting very fatigued again. I think I'm putting weight on around my midriff again, which is what I did prior to presenting with this in the first instance. I don't appear to get anywhere near as much oxygen into my lungs as I did. So basically, I've come back today to try and get some results because I'm feeling I'm starting to rapidly go downhill.
David was diagnosed with a very rare condition called thrombotic microangiopathy and ended up on intensive care. This condition affects the small blood vessels in our organs, most often the kidney, and causes them in some cases to shut down, which is what happened with Mr. Taylor. He required dialysis of his blood. Your full blood count was normal, so there's nothing wrong with the actual blood cells. Your kidney tests were much in line with the ones you've had before. And actually, probably your function of your kidney is better than it was.
Obviously, I know that I've got kidney damage from the disease, but in my mind, I'm thinking, have I got other damage? You know, so is it likely that I, or is it possible that I have lung damage? And clearly, from what I've been reading, it's a possibility. So
and you're having some lung symptoms. So I think what I'll do is I'll write a letter to the chest clinic and get them to give us a second opinion, and we can take things forward that way.
Okay, that's great.
All right.
Lovely. Thank you very much.
No problem.
Okay.
Take care. Bye bye.
Come in, all.
Very much, thank you.
That's it. Have a seat just there.
Look there.
Yes, please. Yeah.
Very much.
Right. So, blood tests. Have you got a good vein for me?
I do hope so. You're usually. I just look the other way.
Oh yeah, we're used to that. That's
Good
fine.
girl, thank you. Good young lady. I'll be really formal. Thank you, nurse.
Oh, thank you. Don't worry about it. It's very common. Right, here we go. Sharp scratch. Well done. You okay?
Yes, thank you. Yeah, thank you. Yeah, on the television, I can watch stabbings, killings, kicking, shootings. If a hypodermic comes out, I look away.
Really?
Yeah.
Oh, that's all right. Right. So give that a really firm push. You may have a colourful bruise on that one.
Oh, it's normal, yes.
Oh, do you bruise easy? Yeah. Okay. As soon as I went in, it just ballooned up.
Thank you very, very much.
Oh, gosh, that's going to be a lovely bruise. With pretty colours.
It's a pleasure to talk to you, thank you.
All right, give that a week. Any concerns, we will write to you.
I've enjoyed meeting you, thank you very much.
And you,
Bye-bye.
take care. Bye-bye now.
So, mole.
I have a mole.
Yeah. So we've got this mole on your back, I think. Any bleeding or
Haven't
pain
noticed
around
any,
there?
no.
I know that moles can be a little bit dodgy sometimes.
Yes.
So
Any family history of any skin cancers or anything like that?
no.
I've had one before.
Yeah, taken off.
Yeah.
Yeah, okay.
Yeah.
I just got a thing about moles.
If you have any moles that are either suddenly becoming quite asymmetrical, so they were around and now are irregular, if you find that they're getting bigger, if you're getting bleeding or itching from them, or they're changing colour, you know, all of those things are quite sort of important to keep an eye on, and if they happen, then come and see us. And yeah, keep using the sunscreen.
Yeah.
That's Julie, who's our HCA for today. All right, come and have a seat down there on the blue chair. So just remind me, it was the 4 on the back, wasn't it? And they were starting to crust and catch on things, weren't they?
5, I think, yeah.
Okay, so the idea is the things that you've got, they grow on the surface of the skin like that. So what we do is we put a needle under here, inject some local anaesthetic under there so that you can't feel any of that. We just slice them off the base and then stick a plaster on the top. That's it. Yeah?
They won't come back. Can they?
They can come back. They can come back in other places because that's just to do with skin type. We try our best to make sure that doesn't happen. All right, can we get yourself ready? I'm just going to get the local anaesthetic ready. Okay. That should be fine. So you're just going to feel a bit of a sharp scratch under each one when I do it, okay? This one coming now. Okay, so that's the 4.
Why do they come on the back then?
They can come anywhere, really. Some people are just prone to them. I mean, the good thing about them is that they're almost always benign. The bad news is that you tend to get more as you get older.
It is regarding my wife's appointment.
Right, okay.
Busy. You're taller.
Oh, you can raise it? Wow, that's nasty. I like that one.
It's nothing particularly sophisticated, really. It's just sort of scraping it off. Not feeling anything sharp, right? Usually the sound is worse than it actually is. All right. All right. That's it, all done. So keep it dry for a couple of days. And then Karen is normal. All right. Take care. See you later.
Do you have that whole northern-southern divide in your house for the accents?
We call them pants.
Yes, I have that in my house.
And you call them trousers. I asked Margaret, and Margaret was like, I've got trousers on, yeah. Yeah, and do you call pants like underwear?
No, it's just weird. Oh, God.
Hello.
Hello, doctor.
Come on in, Leslie.
Thank you.
So I've been reading letters about you, yeah?
Oh, you got a few.
I've got some, yeah. So you went to the Blackouts clinic, and
Yes.
was there a cardiology letter I got this morning?
You should have a cardiology, respiratory, and a blackout.
Wow. Leslie has been diagnosed with bird fancier's lung, which is an allergic condition. It can be triggered by bird feathers, by animal fur, by quite a lot of things. In his case, we think it was probably bird-related. At one point, Leslie was keeping up to 500 birds. What is it that you're scared of? In the past, Leslie's been very anxious about his health, and that's sometimes made it more difficult to treat.
Shall we start with the respiratory?
Right.
They were quite happy with you, weren't they?
Yes, I think so.
CT scan looks okay?
Yes, they got...
Nothing nasty going on?
No, as far as they're concerned, it looked good. I'm getting better sleep.
Yeah.
Got better mindset.
Feeling more...
I got better mindset at the moment because after waiting 18 months with nothing being done, it's at least something being done at the moment.
And you know that things like your lungs, you may reach a stage where they say this is probably as good as we can get.
As I said to you before, I didn't expect it to be any better. I just want to know that it's got worse or it's still the same. And when will I be seeing you again?
Well, shall we wait until you've had some of these tests done now?
Right.
Yeah? So when you've had the angiogram, when is that?
Week today.
Tuesday. A week today, OK. So if I see you a couple of weeks after that,
that'll be fine.
gives time for them to get a letter to me.
I'll put an appointment at the end of the month.
You can squeeze me in with all your other appointments, yeah?
It's very satisfying to see Leslie in better health. He's breathing better, his mood has improved, he's just generally more cheerful.
Thank you very much, Doctor, for your... I say good to come in and find I'm not as bad as I used to be.
Take care, bye-bye.
Bye-bye.
Musa Siddiqui? Yeah. Oh. Come and take a seat. Your mum, yeah? Yeah. Lovely. I'll just bring up Musa's files. And Musa is 13 years old.
Yep.
13 and a half. Lovely. How can I help?
OK, so he's been having problems with his right ear for a few weeks now, and he constantly feels he needs to pop his ear.
And any recent travel on a plane? Nothing?
No.
So just started with what, a bubbly sound?
When you, like, don't unpop it, it hurts even more when you pop it.
Yeah.
But, like, if you just keep constantly popping it, it doesn't hurt.
And have you had any trauma to that ear? Have you had a hit to the head or anything at all?
No.
OK, and have you had any water that's gone into that ear recently or done any swimming recently?
He hasn't done swimming, but he does have showers a lot. That's what I was thinking maybe, but whether that's normal or what.
OK. So sometimes you can get this thing called eustachian tube dysfunction. That's the tube, the eustachian tube that connects your throat, your ear, nose and throat, basically, and it can get blocked with phlegm. So the outside of the ear, and then there's the eardrum, and then which is that thin flap, and then you get the middle ear, and you have to constantly make the pressures the same by doing that popping sensation that you're doing. Let's just do your temperatures and things. Any no swelling or any pain behind the ear or anything like that? OK, let's have a look in the normal ear. So you've got some wax in this ear. There's a couple of little hairs, actually, right at their back. But the eardrum's intact and it's shiny. I think it's a little bit white, so a bit of fluid behind the eardrum. But actually, the eardrum's intact. It hasn't popped or burst or anything like that. There's nothing nasty in there. Because he's 13, I think we should try the spray and the eardrops to help alleviate this popping sensation. If you do have any mucus in the nose, blow it out, try to get it out because it can get stuck. There you go.
Thanks.
Lovely. There you go. Cheers,
Thanks
bye.
very much.
Yeah, I'll go to lunch at 1. I've got cottage pie.
You've got cottage pie, look?
Yeah, cottage pie.
Cottage pie?
Cottage pie.
Oh, I want cottage pie. What's cottage pie?
It's got mashed potato and like mincemeat underneath it.
Is it because it's made in a cottage or something?
Yeah. And the shepherds make the shepherd's pie.
Which one's lamb and which one's beef?
Beef.
Shepherd's pie's lamb.
Oh, shepherd's pie's lamb.
Cottage pie's
is the beef.
Hello, it's Dr. Hyder. Come and have a seat. And how are you?
Not too good.
What's been happening?
I've been getting pains.
Okay.
And it's been going on for a long time. That I get loose bowel motion.
Okay, all right.
But the pain is really bad, and sometimes I don't feel like eating, but I've got to eat because I'm on tablets.
Yeah, so what's happening with your bowels? Are you loose or are you constipated?
No, loose.
Loose. Okay. Any blood in the poo?
I never know. I never look. I just go and that's it.
All
but
right. So how long has it been loose for, do you think?
For a while. And I've also lost weight.
How long have you noticed the weight loss for?
About a month.
About a month. Okay. All right. And then the change with your bowels, how long has that been?
About 6 months, I suppose.
Okay, so that's quite a long time,
It's a
6
long
months,
time,
isn't it?
but-
And then the pain, for how long?
About a month.
About a month as well?
It's not,
okay.
yeah.
And appetite, can you eat?
I'm not really fancy anything.
And the weight loss, how much weight have you lost, do you think?
I was a size 22 and I've gone down to 20.
Right.
And even these jeans are 20 and they're loose.
Okay. Has anyone else mentioned that they noticed that you've lost
Yeah,
weight or anything?
friends at work.
Swap the naproxen for a slightly different anti-inflammatory, because it's not doing you as it should do. And I'm going to increase the diazepam just so you get some relief.
Take a seat there. Let me have a quick look.
Does it look swollen? Is this one here? It doesn't look as much as it sometimes does and doesn't. This one here.
Yeah. I'm just having a look. See, the triggering occurs
Yeah,
not in here,
no.
but it occurs down in here.
Exactly.
And it's just about there where it's happening. So there's a little nodule almost that
Can you
goes
feel it,
through
can
there. Yeah, you can feel that. So the injection goes in down here.
Okay. So these probably cortisone injections, is it something that doctors like to give out or not really, or just...
It's a treatment like anything else.
Yeah.
And it's appropriate for some people and not for others. Like anything, there is a failure rate. But I think, hopefully this will reduce the inflammation and we'll see how we do it. And if we tried a few of them and it's not effective or it's getting worse, then there's an operation that can be done. But, you don't want to go down that line if we can stop it with something else. Okay, mate?
Yeah, that's it, yeah.
Okay, a little prick now. Sorry. It's always tender. Well done. Let's pop that there.
Yeah, lovely.
Lovely. Thanks for the pain.
Exactly, yeah.
Happy days, mate.
Shall I put the money in there or?
Yes, please, if you wouldn't mind. Thank you very much. Thank you for your support.
Is there any stress at work at all?
No, I have been under stress because I lost my sister.
Oh, no, I'm sorry to hear that.
But I'm feeling very tired at the moment.
Is it okay if I examine you?
Yeah, that's fine.
I need to examine your tummy just to feel that, and we need to examine the back passage as well, if that's okay. It involves inserting a glove finger into the back passage, and I'll tell you what I'm doing, so it won't be anything you're not expecting.
Yeah.
Okay.
Christine has a family history of bowel cancer and also presented with several months of loose motions and had some abdominal pain and weight loss, which was worrying.
And where is the pain at the moment?
It goes in my belly button.
Okay, so it starts up at the top and then
Yeah.
goes down. I'm just gently going to press on your tummy.
See, that's tender there.
That is, sorry. Oh, that is tender, isn't it? For the back passage examination, if you just lower down the bottom bits, I'll give you a moment to do it. Can I come through again?
Yeah.
I've got some cold gel on a gloved finger. I'm just going to have a look at the area to start with. It looks a bit sore. Sorry, can you take a deep breath? Sorry about this.
Oh, sorry.
I'll let you get dressed and then come and have a seat when you're ready. There's no blood and everything inside feels normal.
Okay, thanks.
Come and have a seat when you're ready. Okay, so from examining you, you are a little bit tender still in the tummy, aren't you?
Yeah.
The back passage examination was normal, apart from it's a bit sore on the outside. The skin looks a bit red, and that might be because you've been having the diarrhoea for so long. But because you've had the weight loss and you've had a long history now, 6 months of the diarrhoea, I think it's worth referring you to get this all checked.
Yeah.
And I think we need to do it urgently on what's called a cancer 2-week wait referral. Okay. So I don't want you to be alarmed by that. But the letter will come in the post. It'll be within the next 2 weeks, and the appointment will be within the next 2 weeks as well.
Yeah, that's fine.
If there's anything abnormal on the results, I would normally contact you. If they're all okay, I wouldn't. But if you've had your appointment with the specialist and you still know better and they say everything's okay, still come back in and see us.
More than 1 in 3 people will develop cancer at some point in their lifetime.
Thank you. Take care.
If it's not you directly, it will be a member of family, friends, one of your colleagues. We're all affected by it.
So where's she having her hair shaved off?
Here.
Right.
Right here.
Get the Hoover out.
It's a big shock when one of your colleagues develops cancer. and one of our colleagues at reception, Glenda, developed ovarian cancer. When is the Great British Shave Off happening?
1 o'clock today.
1 o'clock, out here?
Yes.
Yeah.
I went shopping yesterday. I thought, I don't need shampoo.
Alison, who is our reception manager, has arranged a charity head shaving event in support of Glenda.
For a woman to actually shave their head is a big, big thing. I think so, anyway. It wasn't till the day of Alison's head shave that it hit home to me that I actually had gone through cancer. I hope I'm back soon to get you all in shape. Reception, yeah. And let's shave. Well done. Wow.
You tickles. My head feels like my old man's now.
I know, yeah, it's quite nice, isn't it?
Yeah, it is.
Mwah. Proud of you.
You're welcome, my darling.
The support I've received from the surgery has been very important to me. They've been in touch constantly, looking forward to having me back as a team member, and that's really been important.
Hi, Barbara.
Hi.
How are you doing?
I'm all right, you?
Not too bad, thank you.
Good morning, Final Road Surgery.
Elizabeth Buchan, please. Hi there, Elizabeth. Come in.
I've had a really bad back. I suffer with
Yeah.
my back quite a
Yeah.
lot. But Saturday, I started playing about with some cushions.
Yeah, yeah.
And something, just like a spasm went off in my back.
Uh-huh.
And then Sunday, it just got worse. So I went to A&E.
Uh-huh.
They said that I've got a trapped nerve.
Yeah.
I'm not able to go to work.
Yeah.
I tried to go this morning.
Uh-huh.
I've just been sick everywhere.
Right.
Really dizzy.
And are you sort of feeling dizzy just sitting still or when you move or?
All the time.
Uh-huh.
I feel really spaced out, really tired.
What I'm going to do is I just want to have a little look in your ears, do another test, and then we'll look at your back. That's okay. Yeah, that's okay. So when you feel dizzy, do you just feel lightheaded or a bit spaced out?
I've
or?
just been sick 3 times.
Yeah. So follow my. I'm going to move my finger quite quickly,
Okay.
but what we want you to do is to follow it for me as best you can. Okay. Does any of that make you feel a bit dizzy? I can tell because your eyes are flickering when they go this way.
Okay.
Let me just have a quick look at your back then and see.
Yeah.
Logan Reed. Good morning, Logan.
Morning.
Hello. All right, what's wrong with you then?
He's had a temperature now for a few days with a little bit of a sniffle.
Yeah.
But he's started to get this cough now, so and because of all these other issues, I thought I'd just get him checked out.
Do you want to take your jacket off and let's have a listen to your chest?
He's had a temperature. It's not been sky high. It's like been 38.7.
Okay.
So it's not.
Is
massive.
epilepsy well controlled?
Yeah, it seems to be at the moment.
There we go. Listen to your back. Crystal clear.
Okay, that's good.
Okay, I suspect it's viral. Most of it is at this time of year.
Yeah.
Which will cause him to have little spikes in temperature and things like this. Paracetamol, as you would normally take, regular fluids.
Okay, excellent. And one of his ears is hotter than the other one. Which one was it, Logan?
This one was
that
hotter
one.
than that one.
Yeah.
You wouldn't get a different temperature because of anything.
Okay.
This is not going to work. It's not been working for 2 weeks. I don't quite know why.
Battery's changing?
Maybe. I think it might be the bulb.
Yeah, maybe the bulb's gone.
Right.
Right, let's hope that it is the bulb.
Yeah.
And not the whole thing's completely blown.
Do you want to stand up for me? It needs new batteries. Yeah, right, here we go.
Yeah, normally the lump has to touch the
Yeah, so
metal bit, but the thingamajig has to touch the thingamajig.
right. We've got a light, I think.
Oh, that's good.
Pitch your head away for me. That is absolutely normal. So we'll go the other side.
Your brains haven't fallen out then, Logan.
Yeah, that's all. There's a bit more wax on that side, but that's also normal. I think this is just a little viral cough.
Okay.
You're fine. Off you go.
Good.
Take it easy. See you later.
Thank you very much.
No worries. Bye-bye.
Now, let me just have a quick look at your back then and see.
Yeah.
Don't think this is related to your back now.
Okay.
Okay.
Yeah. The pain is right
Here, yeah, okay.
but it's going
Up here. Oh, wow. These are really tight, aren't they?
Yeah.
Okay. Can you bend even further forward or
I
no?
can bend right down.
Yeah,
It
but you
feels
can't come
actually
back.
nice.
Yeah. Okay, that's good. Just sit yourself down. Okay, I'm not entirely convinced that you've got a sort of trapped nerve.
Okay.
Because normally you'll get the pain going down your leg as well.
Okay.
But also, normally sort of bending forward will make the nerve more painful.
Right, okay.
So we can give you something to help relax the spasm. Now, the dizziness and sickness, when I'm getting you to move, you're getting some flickering of the eyes. Now, that's which we call nystagmus, which just means flickering the eyes.
Yeah.
It usually means that there's possibly some fluid in the inner ear that is causing you to be dizzy and sick, because you've got a balance mechanism in there, and there's a little ball floats on some fluid. When you get more fluid in the ear, you can get more fluid in here, and the little ball doesn't respond quite as quickly as your eyes do when you move, so your brain gets 2 signals instead of 1, and it makes you feel dizzy and you can be sick.
Okay.
Now, I am going to give you something to help with that,
Okay.
as well as the back. Are you just taking the cocodamol?
I've got diazepam, so I took it once, and
Yeah.
I've got a little boy, and
Yeah.
it was just me and him.
Yeah.
It knocked me out.
Okay, try half now. If there's somebody around that can look after the little one, just in case it does zonk you out, that would be helpful. And keep taking your cocodamol and the naproxen as they told you. Okay.
Thank you very much.
Okay then.
Thank you very much.
Bye-bye.
You love this in now?
No.
You have a cup of tea?
Yeah.
A few biscuits.
Good.
Do you want to come and work here? Do you want to come and work here?
No.
Tanya Williams. Just caught my shirt. There you go. Come and have a seat down there. How you doing? All right. So, what's been happening?
I was at work yesterday.
Yeah.
I do office jobs, so
Yeah.
I'm sat down most of the time.
Yeah.
It's about 10 o'clock in the morning, and I noticed a kind of like a dull ache on, like, right underneath here.
Okay.
And I kind of thought, I'm 24 weeks pregnant, so I thought, oh, my trousers are too tight.
Yeah.
So I undone them, and I was like, oh, it'll go. Had
Okay.
my lunch, I thought I might be hungry.
Okay.
Didn't go, so I thought, okay, take some painkillers.
Okay.
The ache's still there, but
Yeah.
now what I'm getting is more like a period pain, kind of really intensified, just on my right-hand side, to the point where I was literally in tears this morning. Like, it was so painful.
Any discharge or any blood?
No blood, discharge, I think normal.
Have you started feeling movements yet?
Yeah, past 3 weeks or so, it's been kind of crazy.
Okay.
Feeling it kind of,
Still the same since yesterday?
not really,
But much less than normal?
yeah, less than normal.
Okay, fine. What I would like to do is have a quick feel of your tummy and have a quick listen if I can find the Doppler. I'll be back in a second, okay?
Thank you. It's really hurting.
David?
David Wallace?
Oh, sorry, yes. Hi, David. Come in. Have a seat, please. All right, how can I help you, David?
This one.
Yeah, I remember I saw you the weekend, isn't
Yes,
it?
Sunday.
Not got any better?
With that medicine, what's it called?
Yeah.
No, the fluoxetine.
Okay.
Mind you, I stabbed it with a needle last night to try and get rid of some of that. But
Why did you do that, David?
no, because it was filling up. Because it was like this. I need to to get rid of it.
Is it painful?
No. At first it was throbbing. Boom, boom. That throbbing is gone.
Okay.
But if you touch it or push it or whatever, then it hurts.
Okay. It looks it's got worse since I saw you.
Mm-hmm.
You should never do it by yourself because there's a risk of infection.
I cleaned the needle first. I licked it. No, it's static. I used hydrogen peroxide to clean it with.
You should never do it. I think I told
But it was getting worse, though. What can I do?
I know. You should have gone to A&E then. Or you should have come to us.
I'm here. If you've got a sharp knife, you could do it right.
No, we don't do that.
You're not squeamish, are you?
Why?
Well, with all the stuff coming out, we could... No. Okay.
David, I don't know how busy you are. Are you able to wait for some time in
Yes,
the
I am.
waiting area? Because I will see if one of my colleagues can have a second look at it as well to see if we really need to send you to the hospital or if we can do it here. All right?
Yes,
Okay?
fine, yeah.
All right, I'll see you soon, yeah?
Yes,
Okay.
So let's have a quick feel. Do you feel it worse when you're walking?
Yes and no. It is. I've got just a dull ache, but it's literally right there.
Sounds okay. I'll just give you some tissue. Okay, so where you're tender when I'm examining you, it seems more likely to be like a ligament strain. But the way you describe it doesn't quite fit, especially because you haven't been feeling the movements as much. Just do your blood pressure first and just make sure everything's all right from that point of view as well. It's time around. It's all right. Oh, hi there. Could you put me through to maternity triage, please? So I have a lady who is 24 weeks pregnant at the moment. It's her second pregnancy. She had preeclampsia in her first. So she's got this sort of 12-hour history of right lower abdominal pain, and her blood pressure and things are all okay. The thing that worries me about this, though, is that it's coming with reduced fetal movements. But her fetal heart sounds are about 130 when I listen, so it sounds more reassuring. Does she need to come in for a CTG with yourselves, or what do you think? Okay, fine. All right, that sounds good. Thank you. Cheers. Bye. Okay, so what they've said is they want you to take two tablets of paracetamol and call them in 2 hours if you think things are not settling. Okay. If it is settling, it's probably just the ligament pain, and they're less worried about the fetal movements.
Yeah.
Is that okay? So I'm just going to write it up in your notes. Okay, so 2 hours' time, if you're thinking I'm not heading in the right direction, I want you to call that number there.
Yeah.
Tell them that this was the plan that we've made, and we'll see how we go from there.
Cool. Thank you
Hopefully,
very much.
it will settle. No problem. Take care.
Cheers.
Okay.
Thanks
See
a lot.
you then.
Thank you.
Hi. Hi. Oh, look at you in that coat. He's a cutie. Do you feel better now?
Yeah, he's much better. He was really bad, so the doctor was worried about it. But...
There we go.
Put your foot down.
There we go.
And smile.
Yes.
We're going to numb it by putting anaesthetic in your finger, and then as soon as it's numb, we're just going to stick a knife in there. Is that okay? And hopefully that'll make you feel a lot better.
Thank you very much.
It's on the left hand middle finger.
I love your shoes. I really like them. I've been looking at them as you've been walking up and down the stairs. They're nice. Quite a well-dressed, and I believe you're a runner in your spare time.
No, I'm a cyclist.
A which?
Cyclist.
Okay.
That's disappointing. Are you a runner?
Yes.
See, I tried to let you down. I'm going to sit you over here.
Mm-hmm.
Is that okay? So, and put your hand on there so it's comfortable. That's it. Yeah. Okay. You ready?
Yeah.
Just look away. Okay.
Oh, that was okay.
was okay.
Yeah.
That should be the worst bit. Should be.
Does the sight of blood bother you?
No. Are you okay?
Yes, thank you.
Yeah. Don't look at it.
Can I look at you instead?
If that helps you, that's fine.
How's your finger feel?
No.
Okay, if you mind just lift your finger up for me. Put your finger down. Okay. Mum will look away. How's that feel?
I can't feel anything.
Okay. No. Right, so that's how it looks now. Letting the pus out should let everything else settle down.
Not much came out.
There's never as much as you think. It's always disappointing. You always think you're going to be going under the stuff.
It would be.
Yeah, you hope, yeah.
A little fountain.
So this is the most challenging bit for the doctors, because of course we're rubbish at dressings, and the nurses are fantastic.
Oh, well.
Okay, so...
Is that why you're not a nurse then?
That's why I'm not a nurse, yes. I had to settle to be a GP because I couldn't do the dressings, yes.
I can put... Oh, can you close that door, please?
Hello. Come on in and have a seat.
Morning, Dr. Bolger. Morning.
How can I help you this morning?
First thing is, I've had very, very dry ears for
Oh, you have, haven't you?
3 months.
Have we tried anything?
Well, we tried Vaseline, a nurse recommended.
E45, and we've been trying them on coconut oil.
Coconut oil, okay. Very inflamed, very angry. I think maybe a touch of some steroids might help with that, some hydrocortisone. It may well be that that makes it much better, and then you can just carry on with the E45 until it goes. If it makes no difference at all after a fortnight on the steroid cream, can you come back and let one of us have a look?
Yeah.
Yeah.
Okay.
The second thing is, do you remember we had this big discussion about why I was on testosterone?
No, I don't remember. Remind me.
He was having injections regularly, and then we were told that something had changed and we had to see Dr. Juanji.
Who's the urologist?
Yes. It was Dr. Juanji that stopped it. I can't remember now.
So why was it for?
I suddenly was getting very, very sore nipples, and I was scratching them. In the end, I was making them bleed. It's come back now, actually.
Low testosterone can cause a variety of symptoms. It can cause problems with sex drive and with sexual function, fatigue, weight gain, problems with hair loss, and it can cause mood disturbance and also sometimes sleep disturbance. Low testosterone isn't generally thought to be a symptom of more serious conditions, and it's recognised that testosterone levels do tend to fall generally in most men from middle age onwards.
And did you have blood tests that showed low testosterone levels?
I must have.
Yeah, I think you did, didn't you, at the time?
Right, okay. Is there anything to see at the moment? Is there any inflammation or redness?
There's only a slight bit of redness, and that's probably been me scratching.
Scratching. Breasts getting larger?
Yes, they are.
Yeah.
They are?
Yeah.
Right.
She's trying to beat me.
There's no answer to that.
No competition.
Can I have a look?
Yeah, sure.
Right, it'd be worth checking your levels. That's all fine. There's no untoward lumps or bumps there. That's good. Testosterone is sometimes given by urologists, and I suspect that when we were a bit nonplussed about why you were taking it, that's why you saw Dr. Juanji. We have the electronic records, obviously. It might be that actually we need to get your records up from out of storage to have a look if it were letters from then.
That should break the porter's back.
They'll need a wheelbarrow just for yours.
Yeah, just for his.
If we start with some blood tests, and then when they come back, maybe if we say we'll meet in a couple of weeks' time, it'll give me time to have a look through. And then I think if your testosterone level is low, then it might well be worth thinking about asking an endocrinologist to see you and giving us some advice.
Okay, lovely.
And obviously when I see you in 2 to 3 weeks' time, you can show me your ears as well.
Lovely, thank you very much.
I look forward to that.
Do you think it'll make him hear any better?
Bye-bye.
Thank you, Dr. Bolger. Come on, we've got to go make a blood test for you now.
tomorrow morning? No?
Yeah.
8:42 or 8:44 or 8:48?
8:48, what? That'll be spot on. What? Yeah.
Which one would you like?
I'll have 8:48.
Or you can have 8:58.
That one. Then that way I ain't got to take it to school.
Okay, that's booked for you then for tomorrow at 9:58.
9:58.
8:58, sorry.
I've got to say, were you cuckoo there?
It's the computers, they frazzle your brain after a while.
I'll be about just before 9 then.
Yeah.
Well done. See you tomorrow. See ya.
Bye.
Serena Martinez. So how can I help today?
Pain I'm going through has been, I don't know what caused it in the beginning. I've always said it's the medication. It's what, my whole body's just gone weak, and like every time I'm concentrating on something I have auras. So I can't even sit down and watch telly too long.
What have you come for today?
Because of the seizures are ongoing, they haven't stopped since then. What they call clusters.
Yeah.
She's having pain in her chest.
Pain, yeah, in the back.
She can't breathe properly.
And you've got an outpatient appointment on.
Yeah, but waiting, I don't feel I can flip and do that. It's pain in my gut. Something, it feels like something's in there and it's getting bigger and bigger, but it doesn't want to come out the rear end. Doesn't want to come out my mouth. I'm burping sometimes, but it's like me forcing myself to burp. I wouldn't be here if I wasn't in trouble. I don't come to doctors unless I need the doctor.
What's the symptom you're worried about most, Serena?
Go in the toilet, I can't get anything out.
You're constipated.
Yes, and there's nothing in me.
Because she's not eating.
It's been like this for the week. So when I had the 9 seizures, and I've been trying to eat. Once I put something in my mouth, I'm going into a seizure. That's not normal. It hurts when I cry. I'm sorry to swear. I can't handle it. I can't handle this anymore. I don't know what's going on.
Have you had any change in your medication for your epilepsy in the last 2 weeks?
They gave me lorazepam when I went into hospital,
Yeah.
and I was meant to be on clobazam.
The lorazepam you're just not taking.
No. I stopped that, I think, yesterday.
And you're stopping taking because you just don't like taking it.
No, because of the feelings it was giving me,
Yeah.
it wasn't helping.
Would you rather have some clobazam
I'm thinking yes, because
in
how
reserve?
it made me feel.
In reserve, in case you have a seizure.
Yeah.
Because when you used to take it, you used to be all right.
Yeah, it used to
You know,
knock me out or just relax me.
But these are not to take on a regular basis. These are to take as and when. Yeah. Have you heard from Chalfont?
He just rang me just now, said he's looking, he's going to get me in ASAP.
I think what's clear is that you need to see the Chalfont consultant, because I think there's some confusion here about what actually is the medication you need for your epilepsy. There may be a bug in your stomach that's creating a lot of acid.
I think so, because something's happening. I'm not eating properly.
I want you to have blood tests, okay? Okay, which you'll have to make an appointment for Monday morning to have the blood test here, because the person doing the blood test is now not in the building. The problem with the tablet that we could use, it can interact with some of your other tablets. The complication at the moment, Serena, is there's a lot going on here, and as a consequence, you're getting an anxiety reaction to all of it as well. It's understandable, but you've got to try to find a way of keeping calm.
Can I just stand up?
Part of your problem is you're getting in a cycle of anxiety about all of your symptoms. And there is, I know, I am conscious of the fact that there is a lack of clarity about your epilepsy management, and that the seizures actually are the most important presenting problem today. Let's get those results back. Let's get you seen at the Chalfont. Let's have you take this away today so that if you have seizures, you know you have confidence in the fact that you have something to take. And then we'll see you again next week. Take this.
It's nothing they can do. It's not them there.
Take it easy.
Yeah, thank you.
Cheers.
I could go to sleep.
I was tired this morning though, like I woke up and I literally couldn't open my eyes.
How can I help?
I'm here for my 6-week check.
Your baby's 6 to 8 weeks?
She'll be 2 months tomorrow, yeah.
Okay. And was it a normal delivery?
Yeah.
Yeah. How did it go?
Yeah, no, it all went smoothly.
Did it well?
Yeah.
So any problems since you had the baby?
No, other than nothing like physically, but like I don't know. Sometimes I just feel a bit upset or whatever, or down. Sometimes I feel like I can't really not look after them. I don't know. I just sort of I'm not myself, if that makes sense. I just feel a bit upset at things and.
Is that happening every day?
Maybe not every day, but like most days maybe.
How much is it bothering you?
Well, me and my husband sometimes we might end up having an argument or whatever, and then I feel really upset. Like I got quite upset this morning, but
And is it an argument over practicalities?
it's
or...
over really simple things, to be honest. And I don't know if that's because we're both tired or if it's because I think he thinks I'm a bit more upset than normal.
I mean, if your sleep's not affected and your appetite's okay, then I think for the time being we can just see how things go. If it starts to become quite all-consuming and, you know, occurring on most days for a lot of the day, then come and have another chat about it, because it might be that you're getting a bit of postnatal depression. That can manifest itself in lots of different ways. It can be that you feel more tearful. It can be that you feel much more tired.
It has been a little while, but I haven't ever come in because I always thought, oh, it'll go soon. Yeah, I don't know.
Come in, take a seat.
Thank you.
Right, what can I do for you?
Well, unfortunately, my back has reared its ugly head again. And this time, I managed to escape from the ambulance service.
Oh, did you?
Yes, I'm working as an endoscopy technician.
Right.
Very keen to actually do the job.
Yeah.
Until I actually got there and started doing it.
And then you think that's making your pain worse?
Yeah, because it's washing scopes in a sink that is very low.
Okay. So at the moment, what's the back doing?
Sharp pinching pain around the actual spine area.
Yeah. Any radiation anywhere else?
I did have an injury at South Central Ambulance Service, and it's on the right-hand side around
here. The buttock, okay, into the hip, okay. No incontinence?
No.
No? Okay, no numbness, pins and needles anywhere?
No.
No, okay. Come and have a lie up here. So how long has the back been a problem for altogether, would you say?
Well, I've been managing it quite happily, even with lifting and carrying patients with the ambulance service.
Yeah.
I mean, the back has been a problem since 1984.
Okay.
I was lucky enough to be involved in a train crash.
Oh, no. Where was that?
Would you believe it's not been documented? I can't find it, but it was the first fast train going into Paddington, and it tried going in at 100 miles an hour.
Wow.
Yeah.
Okay. Right, could you lift that up straight for me? How far can you go?
About there.
Okay, and that makes the pain worse when you go any further than that? Okay. Have a sit up for me slowly. Okay, if you can spin around this way so you're still sitting on the bed. Okay, if you pop your hands behind your back and just slowly come forward for me. So, down. I'm just going to move that leg up. How far can you go with that?
Just there, basically.
Okay. Up. You can pop those trousers back on again now. Okay, I think you need, well, a couple of things. What medication are you taking at the moment? Anything?
At the moment, I'm constantly taking paracetamol and ibuprofen.
Yeah. I might give you some paracetamol with codeine at the moment.
Just continue exercises.
I think you need to continue the exercises.
I can't actually stop moving because then I'll seize up.
Absolutely. But the underlying problem will still be there, and also the work-based problem will still be there as well.
Right.
And that needs to be sorted, doesn't it, really?
It does, yes.
Either by a new job or by them suddenly finding money to put a new sink in or a change so that you don't do that thing. And, you know, I'd be more than happy to say, yes, you can do the job, but you can't wash endoscopes in a low sink.
Mm.
And I can put that on a note to say, could be fit for work as long as an adjustment in duties.
All right, lovely.
Good.
Thank you very much.
Okay, mate. Take care.
Thank you, I'll try.
Watch out for fast-moving trains.
Yes.
See you later. Bye-bye.
Had you got to the stage where you thought you might need some help with some medication or some therapy, or is it?
Yeah, no, I always thought maybe talking to somebody. I don't know if that would.
Well, you can refer yourself to something called Healthy Minds.
Okay.
And they can arrange for you to have some help.
Yeah.
If you feel that that's not enough, or you need a bit more help, then you can always come back in and see us here. There's no one out there scoring you for being the best mum in the world. There's no real right and wrong. You just got to be happy with how you're doing.
Yeah.
It's hard. It's very hard, especially with two. That's very good. And are you ever feeling it totally overwhelmed, or do you ever feel like self-harming? Or
no.
So, are you happy with that? Are you happy to have a chat and see with Healthy Minds and see if they can offer some therapy?
Yeah.
So see how you go then. If you have any problems, just come back. That sort of thing. Okay.
Well, thank you very much.
All right, thank you.
Hello, how are you? Oh, thank you. It wasn't required though. How are things? You're looking very young now.
No, I've been an editor in Italy.
Did you?
3 friends, 2 o'clock, we went have a snack in my apartment. We drink 3 liter wine, but only a couple glass. And my friend said to me, can you take this glass to the kitchen? You believe it? I went on the floor, I broke the glasses, I never cut myself. He said to me, I went dead. I said, why didn't you call it at all? Why didn't you call my wife? I thought you drink too much. What do you mean I drink like you?
Okay.
I think my heart.
Take care.
My heart, I think, fell back.
I think we need to do a thorough check of your heart today then. Yeah. I'm just going to quickly listen to your heart now. The heart is beating regularly, around 60 beats per minute, yeah? Just take some nice deep breaths. In and out, in and out. That's good. Thank you.
Maybe I need operation, no?
I don't think so. I'm a bit unsure whether it's related to alcohol, whether it's related to the pacemaker. But what we can do is organize a heart scan to look at the latest functioning of the lower chambers of the heart.
I give a bottle to the girls. You know the girls?
Yes.
I bring the bottle of wine too.
Oh, did you? They'll be very happy.
This is my picture. Look.
That tastes really good. My wife says that. So blood test, echo scan, continue the current medications, and we'll meet back in 4 weeks' time.
I make wine now. I've been very busy for 2 weeks.
How are you? Make sure you drink in moderation because the warfarin interacts with alcohol. So when I say moderation, in your situation, just a glass.
If I drink wine Guinness, I tell you, doctor, I don't drink wine.
Do you drink daily?
No.
No.
Only water.
Okay, that's good. Keep up to it.
I used to drink that.
Take care.
See you.
Bye-bye.
Thank you.
Yeah, you're not in for disappointment in this clinic.
I'm hungry.
I am as well.
Juliet, soup.
Yeah, that's all I had. God, I'm always hungry as well.
Mind you, yesterday, I don't know what I was doing, but every time I was walking out that way, I felt as if I was losing my trousers.
Oh, God, really? That's good, isn't it?
It is good. It means I'm losing maybe an inch or half an inch or a fraction even.
Susan Dorel. Here he goes. Hello. Hi, come on in. So I've got Claudette, who's here to help you and me.
Oh, I am terrified.
Oh, please don't be.
Well, what happened the last time? I couldn't sit down for a week.
Really?
Yeah. Really.
Okay. Okay.
And the other thing I was going to ask you, someone close to me has just had a breast cancer scare, and she yelled at me and said, "You must check your breast." But I've never done it, and I don't know how to do it. So I just wondered whether you could show me how to do it as well.
Okay. So I can check your breast today, and then what it is it's more about being breast aware. So I'll show you how you can check it yourself. I just need to have a quick look at the cervix so that I can do a smear. It may be a little uncomfortable, but if at any point it's actually hurting you, then I'm not looking at your face, so you need to tell me to stop, and I will stop. You're the boss here, okay? This is not a torture chamber, so you are guiding me, okay?
Not
All
a
right.
torture chamber, she says.
It's quite worrying that 1 in 4 women do not attend for their cervical screening tests, more popularly known as the smear test. In spite of a well-organized national cervical screening program, about 800 women die each year from cervical cancer. Cervical cancer is an extremely preventable disease. In fact, it's probably one of the most preventable cancers. So my plea to all you women out there who are due a smear test is to ask you to put your fear and embarrassment aside. It could save your life.
Things us women have to go through.
I know, I know.
I am terrified.
So if you relax like you did, you're very good. Okay. It's really, you're very cooperative, to be honest.
A friend of mine said that you don't have to have them if you're not sexually active. Is that true?
Have you never been sexually active?
Well, I've had the odd boyfriend.
Then it's worth having it. Okay, so
Well done, Susan.
I've done the smear. Okay.
Wow. Really?
Yeah, okay. So I could see the cervix looks normal. So you wanted me to check your breast side, didn't you?
Yes.
Do you want to come in, Claudia? All right. Yeah. You've never had any breast lumps or anything like that?
No.
Okay, and the way to feel it is with the flat of your hand.
Right,
Okay. Perhaps, once a week or once a month, whenever you get the time, you can stand in front of the mirror, look at your breast, see if there's any asymmetry, is one sort of a nipple looking a bit different, any discharge from the nipple. Okay, sit up for me. And if you feel any lump at any time, at the moment, there's nothing to worry about at all. Okay? And take a seat.
That is such a relief.
So what happens now is that you get the result, and if you get the letter and you're worried and you want to speak to me, then give me a call and I'll call you back.
Thank you ever so much for your help.
Pleasure. I'm glad we could help.
I'm so glad that it went all right. Thank you very much.
Pleasure.
Okay, thanks very much.
All right.
Susan. Thank you very much.
All right, take care. Bye.
I was doing this to my head, right?
You got a headache?
Yeah, I've gone really bad. These
Hug a
lights
doctor.
are horrible.
Hug a doctor.
Hug
I
a
did.
doctor?
Yeah, because they said on the television, instead of keep taking paracetamols or something like that, it says hug a doctor. So just hugging is a form of calming down, I think.
Oh, give us a hug.
But I'm not a doctor.
Oh, it's gone?
Yeah, right.
Hello.
Hi, how are you?
We're not well. No, see, we're not well.
We're not well.
No, we're not well.
In what way are we not well, Malachi?
He's got a rotten cough.
Yeah, since when? When did that start?
About 3 days now.
Yeah. Mm-hmm.
He's not eating very well.
Yeah.
And he's not drinking very well either.
Okay.
But we still have had some wet nappies, so I'm not too concerned.
Yeah. Is he running round?
Apparently not.
I think this is his stock answer to every question. He'll shake his head.
One
We're just going to
minute.
take your temperature, Malachi. It's okay. Good. Can we pull this Batman up? So tell me, is it true that you are actually Batman? Or are you just wearing? I can hear your chest better when you scream, you see. I can. Yeah, good.
No, you're done.
We're all finished. All
It's
finished.
all right. It's all right.
Yeah, so he's got a very mild viral pharyngitis. It's a slight viral infection of his throat. His chest is really good. He's obviously got the same virus in his nose. Ears normal, neck normal.
Can't we just take all the bugs out of my baby?
He needs those bugs to strengthen his immune system so he doesn't come down with
It's all
important
right. He
diseases.
doesn't need an immune system. I'll stick him in a bubble. It's fine.
Oh, I see. OK. So all you've got to do, give him something like Calpol. It's going to kind of feel like this still. Same symptoms about another 48 hours. They begin to disappear at that stage. But, of course, they could come back.
We don't want them to come back. We can positive things, please.
Well, do you want the truth or do you want fiction?
No, we want facts.
Yeah, well, facts.
Bit of fiction at the end, though. Yeah?
Hopefully, it won't be fiction.
Rhetorical question at the end.
Oh, very good. I'm very impressed. I'm very impressed.
And a tip.
What's your top tip for today? Have you got a top tip?
To brush your teeth.
I do.
Yes, that's very good. They're really important. So important for your health to brush your teeth every day. Top tip for health. When you're feeling cold and unwell, honey, lemon, cloves, whiskey and hot water.
The one home remedy that really seems to work is that when you're feeling very sick, leave some lemonade to go flat, and then sipping it slowly really helps settle your stomach.
If you've got a lot of trapped wind, peppermint's very good.
It's the cleanest it's been.
Is it? Honey is really good, you know.
Good morning, sir. The weirdest tip I was given from a farmer who said that he put a rasher of back bacon in each of his socks to treat his hard feet.
When my mother was alive, she says, going into the sea with your feet is the healthiest thing you can ever do.
Okay.
One top tip my mum always used to give me was turmeric ground down and mixed in with warm milk. And she swore that it was the remedy for any ailment that I had.
Have you heard the expression that we've got? You should put nothing smaller than your elbow.
Yeah.
No, in your ears, yeah? No, sorry, nothing bigger than your elbow. They're not smaller.
Yeah.
So you should, in other words, you shouldn't put anything in your ears.
People underestimate the importance of getting involved in their community. It keeps you healthy, it keeps you positive, keeps you well, wards off loneliness, wards off depression and anxiety. Bye-bye, Malachi.
I'm sorry, thank you for entertaining my thug.
You're more than welcome.
Thank you, Doctor.
You take care. Bye-bye.
Bye.
Bye-bye. So sweet.
That's it, finished. I'm done. Does it?
Very good. I'll see you later.
Thank you very much.
Bye-bye.